Member of Parliament for Shiwangandu constituency, Mr. Stephen Kampyongo, was asking a follow-up question to the Minister of Health. So we expect the Minister of Health to respond to that question, which was raised by Mr. Stephen Kampyongo, Shiwangandu constituency Member of Parliament.
And still to come, we expect...
And of course, still to come, we do expect the House to consider 4 questions of ordinary nature, understanding Order 80. Question number 2 is coming from Mr. Chinga Miotu, Kalabo Central Constituency Member of Parliament, to ask the Minister of Energy whether the government has conducted a feasibility study on major rivers to ascertain their viability for hydropower generation.
And another question is expected to come from Mbawala, Member of Parliament, Mr. Joseph Musanje, and he will be directing his question to the Minister of Finance and National Planning. He wants to find out what measures the government is taking to implement the provisions of the Abuja Protocol on Health Financing.
Mr. Lameke Hamwata Pemba, Member of Parliament, to ask the Minister of Health when the government will procure an X-ray machine for Kasia Main Hospital in Pemba District. B, what the cause of the delay in procuring the machine is, and what the estimated cost of the machine is.
Another question number 95, will come from Chilubi, Member of Parliament, Mr. Mulenga Fube, who will be directing his question to the Minister of Education. He wants to find out a question in 4 parts. In part A, what staff establishment for teachers in Chilubi district was as of June 2025? In part B, how many teachers were deployed to the district from January 2025 to July 2025 year by year? Part C, how many officers that were deployed to the district from January 2022 to July 2025 were residents of Chilubi district and had been retained in the district as of July 2025? And in part D, what the shortfall of teachers for the district was as of July 2025.
After consideration of those 4 ordinary questions, understanding Order 80, the House is expected to consider the Zambia Institute of Procurement and Supply Bill, National Assembly Bill number 11 of 2025, to be considered at 3rd reading stage.
Earlier on, we did have Her Honor the Vice President's question time. This is a segment of 45 minutes where members of Parliament are given an opportunity to ask Her Honor the Vice President questions without notice.
Yes, indeed. After that, we did see the leader of government business in the House, Her Honor the Vice President. She did give the business statement of the House from 25th November.
Madam Speaker.
5th November to 5th December 2025.
And so bells are ringing. It seems that we don't have a quorum in the House. It is a requirement that 1/3 of members of Parliament must be present in the House for any business to transact. And so once the quorum has been formed, we expect our business of the House to resume. And at the time, business was suspended at 10:40 hours for a 20 minutes health break. The House was considering a ministerial statement that has been presented by the Minister of Health. This is on the government's preparedness to prevent an outbreak of cholera across the country. And on the floor of the House was a Shiwangandu Member of Parliament, Mr. Stephen Kampyongo, asking a question to the Honorable Minister of Health in line with the ministerial statement that he has delivered on the floor of the House. So once the quorum is formed and business resumes, we expect Shiwangandu Member of Parliament to continue asking his question.
Just TV channel 272, Go TV channel 28, and Topstar channel 5. And on our socials, our official Facebook page is the National Assembly of Zambia. If you have not yet liked it, please do so that we can follow the proceeding there. And you can also follow the proceedings on YouTube as well as on the streaming.
Earlier on, we did have some announcements in which...
Order. When business was suspended, the House was considering the ministerial statement presented by the Honorable Minister of Health on the government's preparedness to prevent an outbreak of cholera across the country. And the Honorable Member for Shiwangandu had just finished asking a follow-up question. I don't know whether he has to repeat, Honorable Minister. The Honorable Member for Shiwangandu, kindly repeat your question.
Thank you, Madam Speaker, for allowing me to repeat the question I just posed. Honorable Minister was saying that in all these areas where you have reported cases, I know you talked about Monze and other areas. If we don't respond in a multi-sectoral approach, in other areas such as Chinsali, which is the provincial headquarters of Muchinga province, and you heard the Honorable Minister, MP for the area complaining about areas which are lacking water. Water is very critical apart from the cleanliness of environments insofar as cholera prevention is concerned. I said multi-sectoral, Madam Speaker, because one of the major challenges the water utility companies are having and failing to supply clean water to the residents is the power, and I can see the Minister of Energy looking at me. The protracted hours of road shedding, Madam Speaker, has affected water supply in many areas. If you go into these communities, even here in Lusaka, you find people queuing up early hours of the morning, even evenings, to look for water. So what I would like to find out from the Minister is, what steps are you taking in a multi-sectoral approach to ensure that these areas which are not yet affected, knowing this is rain season, are given clean water supply, just as you did to UTH where you have given some money? I thank you, Madam Speaker.
The Honorable Minister of Health.
Thank you, Madam Speaker. It's quite a loaded question, but I'll respond to him accordingly. Thank you, Honorable Member of Parliament for Shiwangandu. First and foremost, when we are talking about road shedding is not permanent, and water is not pumped every minute. When there is electricity, water is pumped into tanks and is distributed. That is, and for your own information, according to my colleagues in the Ministry of Energy, they don't road shed or pumps at the water. Yeah. That is one. Talking about multi-sectoral coverage, we have active epidemic preparedness committee at the national, provincial, and district level, comprising all key ministries. And during these meetings, challenges of access to safe water are discussed, and ministries, institutions put in appropriate measures. Let me also explain when I said there is no capacity. I didn't mean human capacity or technical capacity. I meant physical capacity, money to address these issues at a go. I have to repeat. They are owed a lot of money such that they don't have immediate money to address these issues of blockage, is pumping or buying this and what have you. That's what I meant by saying they have no capacity. I meant physical space was limited, but with money, this will be addressed. Madam Speaker, we have the monitoring of chlorine levels in water supplied by utility companies everywhere. Rehabilitation and drilling of boreholes in cholera hotspots, they are also monitored Provision of temporary water points in affected districts is monitored. And enhanced food safety measures, including inspections of food premises and also community sensitization. These are the about sectoral issues we are talking about: the Council, Ministry of Health, and the water and the sanitation. Especially now, we are collaborating even more than before. The only thing which I'm repeating is the fiscal space. We are dealing with UTH, we are dealing with Kasumbalesa. When we finish those areas, we are going to other areas. With fiscal space, we are going to address everything. We are saying this government is up to speed to address issues affecting our people. I thank you, Madam Speaker.
The Honourable Member for Kasama Central.
Thank you very much, Madam Speaker. Honourable Minister, just from the point that you're just from raising concerning fiscal space, Northern Province is also a hotspot. Our figures are rising each and every single day. If we look at the status of Chambeshi water and storage, the water and sanitation facilities and infrastructure are a bit old and not in such a good state. We're looking at preparedness. We all do appreciate that the fiscal space is tight, but the cholera issue is also an emergency because there's deaths that are involved. There's two types of households. There are those that are being supplied by the water utility plant, and there are those that are still getting water from wells, rivers, and other sources. Honourable Minister, is the ministry assisting water utility companies in the provision of water purification chemicals? Because you have stated yourself that there's issues there. Their fiscal space is really tight. And is there also provision for those that are getting water from other sources to be given chlorine per household so that it also alleviates the issue of clean water? I submit. Thank you.
The Honourable Minister of Health.
Thank you very much, Madam Speaker, and thank you for the follow-up question. Indeed, like in Kasumbalesa, I said we had to chlorinate most of those wells. And chlorine is available in most areas, especially those which we feel are likely to be affected. I'm aware about Kasama, and you and me are talking. I've gone in public that after UTH, I'm coming to Kasama. I inspected. I know what is happening in Kasama. And I know what's happening in Solwezi. And I know what's happening in the Eastern Province in big hospitals. We are going to deal with that. But if you feel in place you need chlorine, because we can't just give chlorine to every Jim and Jack. We just have to give it to areas which we feel are threatened with the cholera epidemic. That we can easily provide. Chlorine is always there. As I'm saying, there are these microsectoral committee meetings which assess. These are found everywhere, in every district. They are there. So they can advise us that there is need and we shall be on the spot. I thank you, Madam Speaker.
The Honourable Member for Namwala.
Thank you so very much, Madam Speaker. Through you to the Minister. Minister, that you have agreed that sensitization is one of the vital measures to ensure that the people are aware of this deadly disease. May I know how soon you think you'll be able to execute the sensitization program through the radio, and if you have the money, how much budget have you allocated towards that so that the people are aware of this disease, particularly in the rural setup? Madam Speaker, I thank you.
The Honourable Minister of Health.
Thank you very much for that question, my Honourable Namwala, Member of Parliament. I think what we should do as a starting point, all community radio stations with the public health officers in councils, they've got public health. But let's pay a bit of money from our CDF. Let's sensitize our people together. Let's not just wait for the ministry headquarters, but let's work together as we are part of the councils. And this is more reason why the constitution amendment wants us back into the councils, so that we can effect some of these decisions, some of these discussions that we undertake. Sensitization is a costly venture, but it helps reduce the cost. This requires all levels, at national, provincial, district, and at a local village. We have our members in all centers, health centers. Together with the councils, I think we can achieve that. Maybe we have to put up a memo to all the councils that we need to up the sensitization on cholera. Thank you, Madam Speaker.
The Honorable Member for Kanchivia.
Thank you so much, Madam Speaker, and thank you so much, Honourable Minister, for your ministerial statement. Madam Speaker, my question to the Minister is what interventions the Ministry is taking for areas such as in Chikankata, where we have the nickel, the Munali nickel mining, and the workers. The information coming is that they do not have, especially the board paid, etc., and they do not have resources to buy chlorine. Is government looking at tailored interventions for communities where the threat of cholera outbreak is on the higher side, and whether or not such communities without the means to buy chlorine would then be catered for as a matter of urgency by the Ministry of Health. Madam Speaker, thank you.
The Honorable Minister of Health.
Thank you very much, Honorable Member of Parliament for Kanchiba. I don't think we have a shortage of chlorine. In any case, chlorine is provided in hotspot areas, and granular chlorine is provided for pit latrines. All these are simple ones if we know, and you bring the information to us, they'll be provided. I don't think we have a problem with the provision of chlorine. That one we are readily able to provide accordingly. I thank you, Madam Speaker.
The Honorable Member for Lukasha.
Madam Speaker, thank you for the opportunity to ask the Minister a follow-up question. Minister, Mpulungu is known as a town through which most cholera outbreaks start from. It's the same every other rainy season. I wanted to find out from a public health perspective, what steps does government make, or particularly this year, what steps have you made to ensure that such an entry point is prevented? Because every spread of cholera actually starts from one spot and spreads to the rest of the nation. I thank you, Madam Speaker.
The Honorable Minister of Health.
Thank you, Madam Speaker. I'm aware about the Mpulungu situation. Mpulungu situation is through contact. Cholera is spread through contact because of fishing. The time when we banned fishing here in Zambia, in other countries, fishing was going on. Zambians used to go to Chipwa, Tanzania. And also even those people used to come to Mpulungu. That's why we are saying we need to sensitize the people, the dangers. Because in these fishing camps, the sanitation aspect is quite saddening. We need actually to sensitize our people who are trading, especially in the neighboring countries, the dangers of cholera. In Pulungu, I know it very well. But because of the trading, and because people don't pay particular attention, cholera is spread. So what we have to do is we have to sensitize people or vaccinate people in Pulungu area or in these hotspot areas. I think that will help us to contain the situation. I thank you, Madam Speaker.
The Honorable Member from Mbabala.
Thank you so much, Madam Speaker, and thank you, Honorable Minister of Health, for that comprehensive statement. Honorable Minister of Health, how much quantities of vaccine do we have for these potential risk areas in terms of prevention of cholera? We've got potential areas, for example, in my constituency, Mbabala Township, highly congested with the bad garbage management, which we need to correct, of course, through the councils. But what is the availability of the vaccine to cater for all potential risk areas in the country? I submit, Madam Speaker.
The Honorable Minister of Health.
Thank you, Madam Speaker. I think my colleague, Mbabala Member of Parliament, was not in the House. I said we have run out of vaccine, but we have ordered 156,000 doses coming to the country. You see, those are controlled by WHO. And each time there is an outbreak, we request from WHO. Those are the people who supply us with the vaccines. I thank you, Madam Speaker.
The Honorable Member for Nakonde.
Madam Speaker, thank you very much. Madam Speaker, Nakonde is a town within two countries, that is Tanzania and Zambia. And Madam Speaker, we are the affected ones, especially that we don't have even safe water, there is no water, and so forth. Now, Madam Speaker, sometimes you find that Zambian government will put some measures to prevent cholera, and yet our neighbors there in Tanzania, they don't put those measures. I wanted to find out from the minister, what is the government doing to make sure that even the other side, they put the same measures that the Zambian government is putting. Madam Speaker, I submit.
Thank you. The Honorable Minister of Health.
Thank you, Madam Speaker, and thank you, my colleague, Member of Parliament for Nakonde. On a lighter note, shift from Lusaka, go and stay in Nakonde, so that you know what goes on in Nakonde. There is a liaison committee led by the district commissioner there. We have meetings with our colleagues across in Tanzania. We liaise on the surveillance. That's why we contained that situation, that outbreak, which came up viciously in Nakonde. Yes, we are aware about the water and sanitation issue, and I put it across that when we finish with Kasumbalesa, we are going to Nakonde. I mentioned the three places: Nakonde, Kasumbalesa, Nakonde, and Kanyama. Money allowing, we are coming so that together with local government, we sort out these issues so that we don't have cholera anymore in these areas. I thank you, Madam Speaker.
The last member, the Honorable Member for Kanyama.
Thank you so much, Madam Speaker, for this opportunity that you have given me. Madam Speaker, indeed, Kanyama is prone to cholera outbreaks. And I would want to echo what the Minister has said, where he made mention that it's not right to put up a pit latrine here and a well where you need to get your drinking water. And that, last year or the other year, I think there was a directive that these shallow wells should be buried. And I think nothing much was done. However, my concern is the Minister made mention that where there is a shallow well and a pit latrine, they will put in something in there. Now I don't know what that something is, of which I believe it should be chlorine. So now my question is, how readily available is that chlorine in the event that need arise? I thank you.
The Honorable Minister of Health.
Thank you, Madam Speaker, and thank you, my colleague, Member of Parliament for Kanyama. Yours is densely populated, Kanyama, and I know the problem is big. We have been discussing, yours mainly the underground water is contaminated. And if you ask the scientists, they will tell you the flow of the water. So we are trying to see what we can do. But the temporal measure, I think what we shall do is we shall coordinate most of those places, just as we are doing it in Kasumbalesa. We are just trying to look at resources, how we can approach it. But Kanyama, actually, really, we need to control, to supply clean water, mostly, and also put community toilets. The model we are putting up there. This, we are trying to mobilize money. We are talking to World Bank, we are talking to other cooperating partners, so that they can help us resolve that issue which you are faced with in Kanyama. It's a concern, actually. You can't blame anybody, you can't fault anybody in there. The population is too big. Tell those Kawanders to go back to Kasempa, Lundas to go back where they come from, and you Tongas go back across Kafue, so that we depopulate Kanyama. It's too much, the population is too big. And this, my friend here, tell your brothers to go back. Kanyama is every, that's causing problem of our population. It's causing us problems, but we are trying to look at the permanent solution. Temporary solution, maybe, as we are saying, we have to coordinate most of those places. Eventually, then we shall decommission more the Petra trains. Thank you, Madam Speaker.
Thank you. Questions for oral answer, understanding order number 80. The Honorable Member for Kalabo Central.
Thank you, Madam Speaker. Question number 92.
The Honorable Minister of Energy.
Thank you, Madam Speaker. Mr. Chingamyutu, Member of Parliament for Kalabo Parliamentary Constituents, is asking the Minister of Energy whether the government has conducted feasibility study on major rivers to ascertain the viability of hydropower generation. Madam Speaker, our response is as follows. Yes, the government has undertaken feasibility studies on major rivers in the country. Among the feasibility studies undertaken by the government and private sector on major rivers are as follows. Zambezi River. Madam Speaker, Vatoka Gorge feasibility studies of the 2,400 megawatts were completed in 2021. The project is spearheaded by the two governments of Zambia and Zimbabwe through Zambezi River Authority. The estimated cost of the project is $5 billion US. The Devos Gorge pre-feasibility of 1,000 megawatts are in progress and various sites are being assessed. The plant, similar to Vatoka Gorge, is being co-planned by Zimbabwe and Zambia, and is located downstream of Vatoka sites and upstream of Lake Kariba. See Ngonye Falls. Feasibility studies of 180 megawatts were completed in 2018. The studies were done by Western Power, an independent power producer, and the estimated cost of the project is $500 million US. And Madam Speaker, Chavuma Falls Hydropower Project feasibility studies of 30 megawatts were completed in 2012 by government. The estimated cost of the project is $156.5 million United States dollars. On the Luapula River, pre-feasibility studies were completed for the 2 sites at Mambirima Falls and the 1 site at Mombututa Falls, with an estimated 789 megawatts. The project is being spearheaded by 2 countries, and that is the government of Zambia and the Congo DRC. On the Kalungwishi River, Madam Speaker, feasibility studies were completed for the development of 244 megawatts, Kabwelume and Kundawika Falls. The studies were undertaken by ZESCO in 2022. Kawompo River, Madam Speaker, feasibility studies of Kawompo hydropower project of 40 megawatts were completed in 2015. Studies were undertaken by Copperbelt Energy Corporation. Madam Speaker, in conclusion, government through the Ministry of Energy continues to facilitate the undertaking of feasibility studies on several rivers across the country to address the growing demand for electricity. I thank you, Madam Speaker.
Supplementary questions. The Honorable Member for Kalabo Central.
Thank you, Madam Speaker. Thank you, Honorable Minister, for a very good response. Looking at these findings, Honorable Minister, the question was on feasibility, meaning this is the outcome. So we have put surety, or we are placing sureties on these findings. As a government, Honorable Minister, amongst these, is there an expression of desire to seriously, I'm using the word seriously, undertake a program on one of these? I'm using the word seriously. Is the government desiring? Thank you, Madam Speaker.
The Honorable Minister of Energy.
Thank you, Madam Speaker, and thank you, Honorable Member. Madam Speaker, the answer is yes. There are a number of these feasibility studies that have been undertaken using the information which is here. There's a lot of progress work that is ongoing. For instance, Madam Speaker, the Vatoka Gorge, there are some works that are going on to make sure that we develop this site. And also Ngonye Falls, Madam Speaker, there are some works that are going on, and this is the private sector participation, and we believe that we are going to see some positive results on that site. Kalungwishi also, Madam Speaker, is one of the sites where some processes are ongoing, and we are looking forward for the positive results of these sites that I have just mentioned. Other sites, Madam Speaker, is also a process and issues to look for resources in order to implement these sites. I thank you.
The Honorable Member for Kamfinsa.
Madam Speaker, thank you for the opportunity to direct a follow-up question to the Minister responsible for energy. Minister, in your response, you have listed literally all the sites that government has undertaken what you are calling a pre-feasibility study. Meaning, after you do a pre-feasibility study, you now need to do the actual feasibility study. And in the actual feasibility study, that is where now you do the design. That is where now you do the actual costing of the project. That is where you even put recommendations of how the money will be raised to develop that site into a hydro plant. Minister, I want you to be very clear. These sites that you have mentioned, is government going to hand over these sites to the private sector, or ZESCO, as the entity that currently generates most of the power from the hydro plants, will then be asked to look for money to partner with the private sector? Because we don't want to lose the opportunity which will allow ZESCO, Madam Speaker, to continue participating in the energy space. So I want to find out, Madam Speaker, are these hydro plants that you want to develop for the private sector or they are for ZESCO? Madam Speaker, I think that this is an important question that requires clarification. I thank you, Madam Speaker.
The Honorable Minister of Energy.
Thank you, Madam Speaker, and thank you, Honorable Member. Madam Speaker, like I've stated that there are some of these sites where ZESCO is going to partner with other developers in order to implement these projects. But there are some of the projects, like the one I have just mentioned, the Ngonye Force, that one is solely under the private sector. So there are some which ZESCO is going to partner with the other developers, but there are some which are just going to be developed by the private sector. I thank you.
The Honorable Member for Kalabo Central. Oh. If you are satisfied, it's okay. The Honorable Member for Bahati.
Thank you so much, Madam Speaker. Thank you, Minister, for your statement. Minister, in your statement, you alluded to the fact that you've done a pre-feasibility study on the Mumbotuta, which is on the Luapula River in the Milenge district, and you've also done a full feasibility study report on the Kalungwishi, which is in Kawambwa. So I want to find out, Minister, from you, have you handed over the Mumbotuta and Kalungwishi to independent power producers? Thank you, Madam Speaker.
The Honorable Minister of Energy.
Thank you, Madam Speaker, and thank you, Honorable Member. Madam Speaker, discussions are underway between ZESCO and private players over these sites. I thank you.
The Honorable Member for Chairman North.
Thank you, Madam Speaker, for the opportunity. Thank you, Honorable Minister, for your answers. Honorable Minister, you have outlined quite a number of proposed site for hydropower, which I believe that I think is a step in the right direction, because the hydropower remains the most reliable sources of energy. Now, most of our hydropower projects are situated in the southern part of this country, which are drought-prone areas. You have mentioned about the feasibility studies on the Luapula River. Do you have a specific time frame to prioritize the investment in the northern circuit where we have got abundant rainfall? I submit.
The Honorable Minister of Energy.
Thank you, Madam Speaker, and thank you, Honorable Member. Madam Speaker, like the Honorable Member, he has heard my submission. Already northern circuit has been prioritized. Hence, these works are going on. So we are aware that currently most of the major hydropower plants are in the southern part of the country. And arising from the climate change effects, we realize that we still continue receiving favorable rains in the northern circuit of this country. So in our strategic planning, Madam Speaker, that's why you see we are trying also to prioritize the northern circuit to have these hydropower plants to make sure that we balance the equation going forward. I thank you, Madam Speaker.
The Honorable Member for Namwala.
Thank you so very much, Madam Speaker. Honorable Minister, from the feasibility studies you have stated, may I know how much power would you want to immediately get from these projects that you have stated so that our current problem can be alleviated? I thank you.
The Honorable Minister of Energy.
Thank you, Madam Speaker, and thank you, Honorable Member. Madam Speaker, these are longer-term projects. These are not in the immediate. But of course, Madam Speaker, if in terms of projected power that we are looking forward to get from these sites, Madam Speaker, in my submission, I've stated that Batoka is 2,400 megawatts, Dev's Gorge, I've said 1,000 megawatts, Ngonye Falls, I've said 180 megawatts, Chavuma Falls Hydro Project, I've said 30 megawatts. Madam Speaker, I've said on the Luapula, Mambilima, and Mombututa, I've said 789 megawatts. Kalungwishi, I've said 244 megawatts. And the Kavompo River, I've said 40 megawatts. But these are not in the immediate. These are long-term projects. I thank you.
I'll get the last two, the Honorable Member for Kaumbwe and the Honorable Member for Chipili. The Honorable Member for Kaumbwe.
Thank you, Madam Speaker. Looking at the potential for power generation using hydro, we are earmarked, of course, for energy exports if we implement all these projects. My question, Minister, is that is government having intentions to fund any of these sites to implement these projects, or you are solely depending on private funding? And if you are intending to fund through our budget, which of these sites are you earmarked for funding? Thank you.
The Honorable Minister of Energy.
Thank you, Madam Speaker, and thank you, Honorable Member. Madam Speaker, that question is almost similar to what I was asked from the Honorable Member. What I've said is that those that purely they are going to be funded by the private sector, but there are some which ZESCO is going to raise some money and partner with other developers in order to implement these projects. So that's how we are going to implement these sites that I've just mentioned, Madam Speaker.
The last member, the Honorable Member for Chipiri.
Thank you, Madam Speaker. Though the question is similar to what my honorable members asked, but I may twist it a bit to ask the Minister, because since he has never come before this August House to state the position on hydropower, they won't talk about solar. Why? Thank you, Madam Speaker.
The Honorable Minister of Energy, though it's away from the question, the main question is about feasibility studies. The Honorable Minister of Energy.
Thank you, Madam Speaker, and thank you, Honorable Member. Madam Speaker, indeed, I've been talking so much on the solar power plants. Maybe, like the Honorable Member has said, very few on, or maybe none on hydropower plants. Because of the crisis that we are going through and arising from the climate change effects, where we realize that hydropower plants have been seriously affected because of the climate challenges effects. Hence, in the medium-term interventions, we are concentrating on solar power plants. That's the more reason why the Honorable Member was getting more of the solar, because we are looking in the medium measures intervention. I thank you, Madam Speaker.
Thank you. Next question, the Honorable Member from Mbabala.
Thank you, Madam Speaker. Question number 93.
The Honorable Minister of Finance and National Planning.
Thank you very much, Madam Speaker. Honorable Musanje, MP from Bawala, asked the following question. What measures is the government taking to implement the provisions of the Abuja Protocol on health financing? The response is as follows. As the House may be aware, the pledge made by African governments to allocate at least 15% of their annual budget to the health sector is what is referred to as the Abuja Declaration. Madam Speaker, this government, in its quest to meet the Abuja Declaration, is implementing the following measures. 1, prioritize budgetary allocation to the health sector, and 2, continued engagement with development partners to enhance financing to the sector. Madam Speaker, based on the outlined measures, the budget allocation to the health sector has steadily increased from 9.65 billion in 2021 to 23.17 billion in 2025, representing percentage increase from 1.8% to 10.7% respectively of the total budget. Madam Speaker, I thank you.
Supplementary questions. The Honorable Member from Bawala.
Yeah, thank you so much, Madam Speaker, and thank you, Honorable Minister, for that response. Indeed, the increase under the new Dawn UPND government has been every visible, from the average 9% during the previous regime to the now 10.7% under the new Dawn to 11%. Now, Honorable Minister, the country also spends finances on health in the military, in local government, and many other sectors. Is your ministry thinking about working with the Zambia Statistical Agency, which is under your ministry, to amalgamate all this expenditure into the health expense in order to meet the 15% Abuja Protocol? I thank you, Madam Speaker.
The Honorable Minister of Finance and National Planning.
Thank you, Madam Speaker. Indeed, Honorable Musanje is correct, because the figures that are read out are specifically those that are under the head of the Minister of Health. What is not included in those numbers, as it says, are the amounts that are appropriated to institutions like the military and other security wings. They are not included in those numbers. And also, Madam Speaker, something that the Honorable Member has made reference to, but maybe I need to elaborate. If you look at the CDF amounts, which are under the Ministry of Local Government, a lot of us here, Madam Speaker, part of what we spend under the CDF is health-related, because we are constructing we are constructing clinics, we are constructing maternity wings, we are rehabilitating old medical facilities, all using CDF. So if you were to consolidate all these various elements, certainly the amount that is going to the health sector will be quite big. I just want to correct an error that I mentioned. I said the percentage share of health in 2021, I put it to 1.8. In actual fact, I transposed the numbers, it's 8.1%. And in 2025, as said, is 10.7. So there's still definitely a big increase from 2021 to where we are today. Thank you.
Thank you. The Honorable Member for Chifubu.
Thank you, Madam Speaker. Honorable Minister, the Abuja Declaration indeed reaffirms the demand of the African Union member states to allocate 15% of their national budget towards the health sector. We want to appreciate that the current government has made a tremendous improvement from 9% to about 10.5%. I want to find out, Honorable Minister, what effect does the current cooperating partners, such as the pulling out of USAID, as the impact it has on the Abuja Declaration as a country? Thank you.
The Honorable Minister of Finance and National Planning.
Thank you very much, Madam Speaker. To start with, I want to explain that, yes, we have the Abuja Declaration, which says 15% of the budget must go to health sector. But I also want to say that some of these agreements that cover so many countries, good as they are, sometimes they don't take into account the specific situations of countries. Why do I say so? I think we all know that health is not just determined by the interventions that we do in the health sector. The state of health is also determined by what we do in other sectors. For example, it has been stated many times before that if you provide interventions, for example, in water, if you provide interventions in education so that mothers know how to keep their children better, those interventions are actually affecting the health sector. So, if you are a country that is doing a lot to provide interventions that are preventative in the health sector, then perhaps you don't necessarily need 15% of your budget to go to the health sector, because you're already preventing their problems. So what I'm saying is that Africa as a whole agreed that 15% of the budget, which is fine, but we cannot necessarily be very prescriptive to say 15% without noting that other countries do not need to go that far because they are getting interventions in other preventive measures. Nevertheless, Madam Speaker, you would agree with me that the withdrawal of some cooperating partners, basically one, could have jeopardized. But it was only a few days ago when we said, when the announcement came, that the withdrawal has been reversed. The $1.5 billion is coming back to Zambia. So for now, at least in the next foreseeable future, this should not really be a concern, as long, of course, as we keep understanding each other with those cooperating partners. Madam Speaker, I thank you.
The Honorable Member for Lunte.
Oh, 1.5. Okay. Madam Speaker, thank you so much. Honorable Minister of Finance, you just confused me with the answer you just tendered now, in the sense that you have given reasons why it should not be important to attain the 15% allocation because of factors affecting different countries are different. Now, as you responded to the question initially, you highlighted the measures you are taking to attain the 15%. And you said you are prioritizing allocation to the budget and that you are continuing engagement with the stakeholders, and I think that's where the 1.5 billion comes in. I did a quick check on the medium-term budget plan for 2026 to 2028. Your text, your qualitative text is on page 16 to 17. You made no mention to those two interventions. If you go to page 41 where your numbers are, here are your numbers in health. 2025, 10.7. 2026, 9.9. Those are percentages. 2027, 11.2. 2028, 11%. These numbers do not show that we are gravitating towards achieving 15%. In fact, your very last number, 2028, has reduced from the 2027 number. How can you reconcile your priorities, the factors that you just mentioned, and the allocations in your plan? I find it very confusing, but you really confused me. I had a good question for you. Thank you, Madam Speaker.
The Honorable Minister of Finance and National Planning.
Yes, Madam Speaker, I will explain. The explanation is that, if I heard you correctly, the ratios were dropping in 2026, 2027, because at the time when that document was being written, the information we had was that some of those donors have pulled back. So therefore, it would take time for us to build up to get back to the momentum that we've been pushing forward. With that position of the cooperating partner reversing, certainly I think you should see increments in those projections, because the numbers you're talking about are projections. So with this information that is coming through now, I think we should be able to reverse that and get back to that trajectory. I hope that is remove the confusion. Thank you.
The Honorable Member for Kanyama.
Thank you, Madam Speaker, for this opportunity you have given me to ask a question. I'm meant to believe, Honorable Minister, that among other ways through which we can enhance on, health funding, is the issue to do with the local manufacturing of these drugs, coupled with the staffing levels in these institutions. Now, if you look at the way your government has performed, indeed, you are promoting that local manufacturing of drugs, which actually reduces the cost of these drugs, cost of importation of these drugs. Then you have actually brought in a number of health personnel on the in this sector. Now my question is, are these two aspects not helping into the achieving of the 15% budget declaration? I submit.
The Honorable Minister of Finance and National Planning.
Thank you. The Honorable Member is saying basically the recruitments are helping the health sector, and therefore those numbers should be reflected in how much we are spending on the health sector. Then he's also saying the fact that we are buying drugs locally, hopefully cheaper, that should also be considered. Let me take those 2 points one by one. On the recruitment, for 2026, the planned recruitments some of which will go to the health sector, are not reflected yet in the numbers. The reason being that it is only after recruitment, and those who have been recruited have been pushed to the Ministry of Health, that's when we can see that the salaries of those people now become part of the Ministry of Health. So certainly, I can say with confidence that when the planned recruitment takes place, and those people are now on the payroll of the Ministry of Health, the numbers going to the health sector are going to improve. On the health side, on the drugs, yes, in fact, this is another reason why we have to be careful about the 15%. 15% is indicative, because in a country where we are trying to do away or minimize wastage, as we are trying to do, what it means ultimately is that you achieve the same with less amounts of expenditure because you've cut out the wastages. Of course, our intention is to honor this commitment with time, but it is also important that the measures that are being taken to deal with wastages, thefts of medicine, corruption, and so forth, it means from the same budget, even as we have it today, we are able to do more because you've cut out the wastage. Madam Speaker, I thank you.
The Honourable Member for Chama South.
Thank you, Madam Speaker. Madam Speaker, let me take this opportunity to thank the Minister and the New Dawn government for the level of stock that is in our hospitals. We are commissioning a mini hospital with the Minister for Eastern Province. Let me report that in almost all the clinics in Chama South, for the first time, we have more than 80% drug stock levels. For the first time. Because why I'm saying this in the past, sorry to say this, Madam Speaker, we used to struggle, absence of essential drugs like painkillers, Coartem, used to be a challenge. For that, we want to thank you, Honourable Minister. And it's important that we put these things on record. Coming to my point of clarification, knowing that Abuja declaration where it needs 15%, what other measures, Honourable Minister, have you put in place specifically to do with preventive measures? I know we consume drugs because of avoidable illnesses like cholera, dysentery, which have to do with hygiene issues, which if we take care of, will drastically reduce expenditure on the procurement of these drugs. What measures have you put in place to ensure that preventive measures are also implemented in our communities? I submit, Madam Speaker.
The Honourable Minister of Finance and National Planning.
Thank you, Madam Speaker. The Honourable Member for Chama South is absolutely correct. First of all, I want to thank him to bring to light the fact that drug availability in the health centers has improved dramatically from, I think, around 40% when we came into office. Now most places are around 80. We are above the minimum thresholds that international expert bodies recommend. On top of that, of course, you may have drugs, and this, I think, also addresses the, so you may have drugs, but if you don't have the professional persons to administer those drugs and administer health in general, it doesn't matter how much money you are spending, you will not be effective. And this is why this government has recruited a huge number of health staff to deal with that precisely. Regarding the preventive measures, I think a lot has been done. As we speak right now, Madam Speaker, we know that things like nutrition itself is a very big preventive measure, because when people are malnourished, they will be less resistant to disease. And you recall, this government, for the vulnerable people in our society, cash transfer system is being implemented. The cash for work is being implemented. It was suspended for a few months to sort out some administrative issues, but it's back on track. Issues of feeding school children. Again, when school children are not fed properly, they are vulnerable to illnesses. This government, year after year, the budget for school children feeding has not just been maintained, but it has been increased. Madam Speaker, I turn now to the issue of CDF. Through our CDF, there are many things that many of us in our constituencies are doing to help to prevent illnesses. Much or quite a significant amount of the CDF money is spent on sinking boreholes so that we supply safe and clean water to our communities. This is all happening across the country in all the constituencies, and certainly these are some of the major interventions that are being implemented to prevent disease. Then, of course, as I said earlier on, issues of education. These young mothers or young mothers-to-be, as they are now allowed to go into schools longer, part of the curriculum of the schools is how to keep themselves better. Issues of hygiene, issues of how to be good mothers. So a lot is happening in terms of measures to prevent illnesses. Madam Speaker, I thank you.
Thank you. My apologies to the remaining three honorables. We are behind time. Next question, the honorable member for Pemba.
Thank you so much, Madam Speaker. Question 9.4.
The Honorable Minister of Health.
Thank you, Madam Speaker. Madam Speaker, let me, first of all, before I answer this question, add a smile to the people of Zambia. I would say proudly now no district hospital level 1 will have no x-ray. Every place now have a list of distribution and many more x-rays in the hospitals. President Akinde directed that all hospitals must have x-rays so that people are not going very far seeking medical attention such as x-rays. Now I've got even some to distribute to Roni and other hospitals that were lacking. This coming week and the other week, I'm distributing those x-rays. So UPND government and Akainde on top of things in terms of equipment in the hospitals. Madam Speaker, Honorable Hamwata Pemba would like to find out from the Minister of Health in A, whether the government will procure an x-ray machine for Kasia Mini Hospital in Pemba district. In B, what the cause of the delay in procuring the machine is. And in C, what is the estimated cost of the machine. Madam Speaker, a handheld x-ray machine has already been procured for Kasia Mini Hospital. The government, being cognizant of ever-evolving landscape of medical technology, handheld x-ray machines have emerged as a game changer in healthcare diagnosis. In B, Madam Speaker, I wish to emphasize that there is no delay. This procurement is fully in line with the equipment plan and the government's commitment to advancing imaging diagnostic services. In C, Madam Speaker, the estimated cost of handheld X-ray machine is approximately $40,000 US. I thank you.
Thank you. Supplementary questions? The Honorable Member for Pemba.
Madam Speaker, this day, Friday, November, is a good day for me to hear the good news from the Honorable Minister. Madam Speaker, a population of over 100,000. For a long time, we have been struggling. For a long time, we have been taking our patients from Pemba to Monze and Choma for such important facility that need to support our people. Today, to hear that Kasia Mini Hospital will have this X-ray machine, it is indeed a blessing and a happy day for the people of Pemba. Madam Speaker, no further question.
I didn't hear any question in that statement. Okay. The Honorable Member from Mbabara.
Thank you so much, Madam Speaker. The people of Kasia in Pemba constituency are our neighbors, and the part of my people in Mutama River there actually use those facilities at Kasia. So, Honorable Minister, are you able to give us the date which we can assure the people of Mutama River who go to Kasia Health Services, the date the X-ray may be put in place so that we can all jubilate together with the people of Pemba on that day who have celebrations, Honorable Minister? Thank you.
The Honorable Minister of Health.
Madam Speaker, that's why I preempted the House of the equipment that this government is proudly distributing. It has done very well. And if that place you are talking about has a clinic which cannot accommodate a big mobile X-ray, the ministry will provide another handheld X-ray to that clinic. That I can promise you. The debt will be done. We are just looking at logistics. This government is taking care of its citizens everywhere, even in Miyombe, even in Shangombo, everywhere, east, north, Rapula. It's not like the way it was in the PF, where they were only supplying one side. This time, Akainde, yes, I'm coming. Don't worry.
Honorable Minister.
Including Chirubi Island. Yes, water units will be coming. Hakainde Chilema has performed more than expectation. This you should do, especially in the health sector. Look at this list, I'll put it there so that it's secreted to see where you are. Now there are X-rays everywhere, the whole country. And then somebody saying, no, this government has done nothing. This, but how about this? The things which we never had for a long time. You will celebrate and celebrate until elections so that you retain Hakainde Chilema and his government to continue. Thank you.
Next question, the Honorable Member for Chirubi.
Question number 95, Madam Speaker.
The Acting Minister of Education.
Thank you, Madam Speaker. Madam Speaker, the Honorable Member for Chirubi, Honorable Fure, is asking the Ministry of Agriculture, Ministry of Education. This question. No, I have it here. What the staff establishment of teachers in Chirubi district was as of June 2025, How many teachers were deployed to the district from January 2022 to July 2025, year by year? And how many of the teachers at B were residents of Chiluvi district and have been retained in the district as of July 2025? And D, what the shortfall of teachers for the district was as of July 2025. Madam Speaker, the answers as follows. A, the approved staff establishment of teachers in Chiluvi district stood at 1,256 as of June 2025. And B, Madam Speaker, between January 2022 and July 2025, a total of 269 teachers were deployed to Chiluvi district. Of these, 174 were deployed in 2022, 43 in 2023, 32 in 2024, and 10 in 2025. The number of teachers deployed in 2025 is expected to increase once the ongoing recruitment process is concluded. And C, Madam Speaker, as of July 2025, 191 of the deployed teachers were residents of Chiluvi district, and 253 teachers had been retained in the district. Finally, Madam Speaker, the answer to D is that consequently, Chiluvi district had a shortfall of 643 teachers as of July 2025. Madam Speaker, I thank you.
Supplementary questions. The Honorable Member for Chiluvi.
Thank you very much, Madam Speaker, for the opportunity to give the people of Chiluvi to ask a follow-up question. Does a minister know that teacher exodus is very high in Chiluvi? I know that he has talked about the establishment being at 1,256, and then another 269 as deployed. But if you do a breakdown, and you say that those that were resident are 191, but does he know that a lot of them has exited from those that were deployed, and they have taken with them the PEMIC point where they have gone? Now the question is that, are you going to track, as a ministry, are you going to track those that are using Chiluvi PEMIC points and showing that the establishment is that high as you have said, but meanwhile they are not in Chiluvi physically? Are you going to track them where they are so that they can be dealt with in terms of withdrawal of that PEMIC point and redeploy more teachers in Chiluvi?
The Acting Minister of Education.
Madam Speaker, to recruit is to hire. To deploy is to assign and post. What the Honourable Member is talking about are assumptions. I answered the question according to what he asked, not assumptions of what we'll do with those who have gone away. Madam Speaker, I thank you.
The Honourable Member for Chama South.
Thank you, Madam Speaker. Madam Speaker, I also want to put it on record that we are very grateful, Honourable Minister, for the recruitment of teachers. For the first time, I think most of our rural primary schools have received teachers. But I want to find out, just to build on what Honourable Member for Chiluvi has said, while the government is trying to bridge the teacher-pupil ratio, others are working against that drive by transferring teachers from rural areas into urban areas, leaving rural areas without teachers. Are you in a position, Honourable Minister, to accept our involvement as members of Parliament? We get the names of teachers that were posted in our schools in rural areas that have been removed, but they still remain being paid as teachers occupying places in our rural areas. The pay points will still remain, for example, Chiluvi, Chama, and many other rural schools, and yet teachers are not there. Are you in a position to accept working with us so that we bring the names of those teachers so that their names are removed from the pay points of our rural community schools so that you, Honorable Minister, you are allowed to send teachers who are willing to save our rural communities. Are you in that position? I submit, Honorable Speaker.
The Acting Minister of Education.
Thank you, Madam Speaker. Madam Speaker, what the honorable member asked is actually what an MP is supposed to do. If in your area, members of staff have gone away and they are occupying your space because the payment is from that pay point, it is your responsibility, it is our responsibility to inform the Ministry of Education so that the teacher-pupil ratio can be managed. If we don't do that, we are making a mistake. The policy is very simple, and all honorable members know it, that no teacher refuses to go to rural areas. If a teacher doesn't want to go to a rural area, give their names to the ministry so that they can be replaced by others who are willing to go in those areas. I thank you.
The Honorable Member for Chirubi.
Madam Speaker, I think I will not be doing the people of Chirubi any good without registering the attitude that Minister has shown. That's not a good attitude when answering questions.
Which
No.
attitude?
Where
Honorable Member.
Madam Speaker, if you were properly the question that the
Please
chairman...
just mind the language. Which attitude?
Madam Speaker, where you are it discards my practical experience on the ground as assumption. As
No,
opposed to,
kindly withdraw the word that you used on the Honorable Minister, the attitude.
I
And
withdraw.
just go straight to your question. Withdraw.
I withdraw, Madam Speaker. I replace it with a laissez-faire. Yes. Madam Speaker, I think I represent people, and I think I needed to indicate that. Because what I'm talking about is a real problem, which should not be treated the way he treated it. And
What
I
is
think
your question?
those who are hearing have taken serious offense with that kind of
What
answer.
is your question, Honorable Member?
My question, Madam Speaker, is that if possible, the minister, I have 24 words, maybe he can talk to the debs or he can speak from the debs to establish next time so that he comes with proper statistics of teacher exodus from Chilubi, because Madam, from what I hear from him, and though I'm trying to avoid to use certain words, whatever I will say will be an assumption, because I have certain questions.
Yes, but it would help us if you just go straight to the question so that the Honorable Minister could respond to your question.
Okay, Madam Speaker, well guided. Some that is very disturbing to be treated that way. Madam Speaker, on the number of 643 as those that are missing, when does the ministry intend to replace so that it tallies with what is supposed to be the establishment, plus those that have left Chilubi? I'm emphasizing those that have left Chilubi and they are somewhere but enjoying the PEMIC space of Chilubi.
Thank you. The Acting Minister of Education.
Thank you, Madam Speaker. Madam Speaker, if you heard my answers, I answered directly to the questions that were given. How many people are in Chilubi? I gave the question. Between this period and that period, how many people were there? I gave the answers. But now to assume that the ministry would know the exodus, whichever way you put it, Madam, no offense, that is an assumption. It is difficult to know how many teachers don't want to be in Chilubi for whatever reason. And that was what I gave. No need to offend you, but to let you know, Honorable, that we cannot determine how many people will leave Chilubi. Now, to answer your question, the staffing deficit of 600 and, what's the figure here? 643 underscores the need for continued and targeted recruitment, particularly in hard-to-reach districts. It is for that reason that the government of the current party has continuously supported education and health so that this pupil-teacher ratio is reduced. That is why even yesterday, Madam Speaker, when I was asked how many people is the Minister of Agriculture going to employ, I said the current manifesto indicates that we should first of all fill in the education sector and the health sector. And that is why even this year we are going to employ, in the current budget, in the coming budget, we are going to employ more teachers so that Chiluvi can reduce that 643. Madam Speaker, I thank you.
Thank you. The last member, the Honorable Member for Kamfinsa.
Madam Speaker, the area member of Parliament for Chiluvi, in bringing this question to Parliament, is looking for a solution for the MP to bring these concerns about people that are originally assigned to Chiluvi, who unfortunately are going into different other localities. It's because there's a problem. And I think that the Member of Parliament was basically trying to establish those details. My follow-up question to the Acting Minister of Education. The problem has been defined by the area MP. I'm sure you understand his complaint. What assurance are you giving to the people of Chiluvi that as he leaves to visit the constituency or as he communicates back to the constituency, the problem relating to those that are shifting from the stations, that issue is attended to? I think that is the issue that the Member of Parliament would want some level of assurance. I thank you, Madam Speaker.
The Acting Minister of Education.
Thank you, Madam Speaker. Definitely, retention incentives are required. Hopefully, together with the Honourable Member of Parliament, we should know why people are leaving Chiluvi Island. Let us together sit down and see what we can do. Let us together sit down and see what we can do. It is important for the local authority and the Ministry of Education to sit and identify what is chasing people from Chiluvi. Madam Speaker, I thank you.
Thank you. Yeah. Okay, the Honourable Member for Chiluvi, what is your point of order? We want to...
Madam Speaker, I sat here listening to the Minister attentively. Then the Member of Parliament is passing a comment that teachers are leaving Chiluvi because of witchcraft. Chiluvi is 75% plus Christian-dominated area. So I don't understand why the Member of Parliament can pass that comment and align it with people of Chiluvi as practicing witchcraft. I take serious offense, Madam Speaker, with that.
Which member was that? Because I didn't even hear him.
I think it should be the Minister of Information. That's where the comment came from. The Minister of Information.
Okay. Apparently, I had not given the...
It was quite loud. You said witchcraft.
Okay.
No, but I'm not trying. You even know yourselves.
Order, honourable members. I think that was not addressed to me. I didn't even hear that comment. However, like I guided yesterday, people are not allowed to debate while seated. That is my ruling. The clerk will now read the order of the day.
The Zambia Institute of Procurement and Supply Bill, National Assembly Bill number 11 of 2025, third reading.
The Honourable Minister of Finance and National Planning.
Madam Speaker, I beg to move that the bill be now read the third time.
The question is that the bill be now read the third time. Any debate, any objection? The question is agreed to. Let the bill be read the third time.
The Zambia Institute of Procurement and Supply Bill, National Assembly Bill number 11 of 2025.
Her Honor, the Vice President, adjournment.
Madam Speaker, I beg to move that the House now adjourns.
The question is that the House now adjourns. Any debate? Any objection? The question is agreed to. The House is now adjourned.
Thank you so much. The House has adjourned, so House resumes sitting next week Tuesday at 14:30 hours. Time now to look at the business which was considered on the floor of the House today, 21st November 2025. Matimba.
When business commenced at 09 hours, Madam First Deputy Speaker did make some announcements. In the first announcement, Madam First Deputy Speaker recognized the presence in the public gallery of pupils and teachers from Yuga Ntanshi Open Christian Community School in Kabwe District. Madam First Deputy Speaker, on behalf of the National Assembly of Zambia, warmly welcomed the visitors to the National Assembly.
In the second announcement, Madam First Deputy Speaker did inform the House that the Research Department under the Office of the Clerk will conduct a research fair from Tuesday 25th to Thursday 27th November 2025 at Parliament Building under the theme Remaining Relevant in the Face of Artificial Intelligence AI.
Madam First Deputy Speaker said that the objective of the research fair is to strengthen the effectiveness, relevance and utilization of parliamentary research services at the National Assembly of Zambia.
She did remind the members to note that in addition to the exhibition, this year's research fair will include two categories of awards to members of parliament as follows. One, awarding over 3 members of parliament during the official opening of the research fair for accessing research services and products, which will be granted based on the number of information requests submitted to the research department in order of the top 3 rankings.
And the second one being awarding of members of parliament who have demonstrated knowledge and understanding of research services and products through participating in a quiz which will be conducted daily at the exhibition stands. Madam First Deputy Speaker urged the honorable members to participate in the research fair which has been organized for them to appreciate the products and services offered by the research department so as to encourage them to utilize evidence in their parliamentary work.
She further reminded the honorable members that they are all expected to be seated in the amphitheater by 09:30 hours on Tuesday, 25th November 2025, in readiness for the official opening, which will be officiated by her.
After that, we did have Her Honor the Vice President, who presented the business statement for the period 25th November to 5th December 2025.
And of course, there were 3 urgent matters without notice which were raised. The first one did come from Chinsali Member of Parliament, Mr. Kalalwe Mukosa. He did raise a matter on water challenges in Chinsali constituency. The other one did come from Chama North, a Member of Parliament, Mr. Yotam Mutaya Chalo. He did raise a matter on alleged political violence in the country. The last one did come from Nakonde Member of Parliament, Mr. Lucas Mumba, and he did raise a matter on the subject matter on the shortage of water at the university teaching hospital. So those were the 3 matters of urgent without notice which were raised by the 3 members of Parliament today.
After those 3 urgent matters without notice, under Standing Order 142, we did have Her Honor the Vice President's question time. This is a segment of 45 minutes where members of Parliament are given an opportunity to ask Her Honor the Vice President's question without notice.
Yes, indeed, after consideration of Her Honor the Vice President's question time, a segment of 45 minutes, the House did consider a ministerial statement. The Minister of Health did render a ministerial statement on the government's preparedness to prevent an outbreak of cholera in the country.
After that, the House went on to consider 4 questions for oral answer under Standing Order 80. And now we look at some of the questions. Question 93 came from Mbabala, Member of Parliament, Mr. Joseph Musanje. He directed his question to the Minister of Finance and National Planning. He wanted to find out what measures the government is taking to implement the provisions of the Abuja Protocol on health financing. And the minister did say the measures include prioritized budgetary allocation to the health sector and also continued engagement with development partners to enhance financing to the sector.
Question 92 did come from Mr. Chingamio to Karabo Central Member of Parliament, who did direct his question to the Minister of Energy. He wanted to find out whether government has conducted a feasibility study on major rivers to ascertain their availability for hydropower generation. And the minister did answer by saying that government has undertaken feasibility studies on major rivers in the country.
And another question came from Pemba Member of Parliament, Mr. Lamek Hamwata. He directed his question to the Minister of Health. He wanted to find out when the government will procure an X-ray machine for Kasia Mini Hospital in Pemba District. And the Minister of Health did say that a handheld X-ray machine has already been procured for Kasia Mini Hospital. And what the cause of the delay in procuring the machine is, the Minister of Health did say that there is no delay as this procurement is fully in line with the equipment plan. In the last part of the question, he wanted to find out what the estimated cost of the machine is. And the minister indicated that the cost is approximately at $40 US.
The other question did come from Mr. Mulenga Fove, Chiluvi Member of Parliament. He did ask the Minister of Education what the staff establishment for teachers in Chiluvi District was as of June 2025. And the acting Minister of Education, who is Agriculture Minister, did say that 1,256 staff establishment teachers in Chiluvi District were employed as the data stated, which is June 2025. And the government teachers were deployed to the district from January 2022 to July 2025 year by year. The minister did say that 174 teachers were deployed in 2025, 43 in 2023, 32 in 2024.
And after consideration of those questions, the House went on to consider the Zambia Institute of Procurement and Supply Bill, National Assembly Bill number 11 of 2025, which came at third reading. It was read the third time and passed. So this is business that has been considered on the floor of the House today, Friday, 21st November 2025. Just now, we take you to a live committee. This is the Public Accounts Committee. Keep watching Parliament Television.